Today, guys, I want to talk about amputation in dogs. There's so much fear and honestly misconceptions about how their dog will do. Were you just told that maybe you have to remove your dog's leg and you're thinking, are you kidding me, doc? This is what you need to know. The majority of dogs do well, and I'm going to break it down for you in this new video. So one of the reasons I want to do this video on amputation is, as a cancer specialist, we're recommending amputation for dogs with osteosarcoma, which is the most common primary bone cancer that we see in dogs. And I lecture all over the country to veterinary professionals. And when I do this lecture on osteosarcoma, I end up spending so much time on the amputation because I listen to what pet owners have told me about how difficult the decision is and how agonizing. And I have had owners that didn't want to do amputation and told me they would euthanize their dogs, but rather than amputate. And then we did things like radiation instead of amputation. 5 or 9 months later, they went ahead and did amputation. I was shocked because I really thought when the leg broke in both of these cases that I'd walk in the room and the owners were going to euthanize the dog, and they're like, no, we'll do amputation. And they were so happy that they did. During my residency, when I was being trained, we would just go in the room and recommend amputation. And I don't think I really appreciated until years of being in practice and talking to pet owners and listening to them how difficult the decision is.
Okay. Turn around this way. Mangus, this way. Come on, buddy. Come on. Come on. Hey, Mangus. Come on. This way. This way. Come on, let's go.
So dogs that we're seeing osteosarcoma are usually 7 to 9 years of age. They're usually large and giant breed dogs. So those are the dogs that are at risk for osteosarcoma. These are dogs that, you would think, oh, you can't remove a leg, but often we can. And often most of these dogs have pre-existing arthritis because they're of middle to older age. And, I've had dogs where they have to have one hind leg removed, and the leg that's going to remain has had a torn cruciate and has been repaired with a TPLO, and our surgeon will do an evaluation and it will be okay. Not every dog is going to be a candidate, but most dogs that many owners and even general practitioners often think are not going to be candidates often will get cleared and can be candidates for amputation. If you're watching this video, you're probably thinking about doing amputation and you're wondering, do we need to do any other diagnostics? Yes, we do. Briefly, you're always going to want to do full blood work. So a CBC, a chemistry panel. One of the things that we're looking for that you're going to ask your veterinarian or your oncologist or your surgeon about is the ALK Phos elevated, or the ALP. That is a predictive test. We always run a baseline urine, and you definitely want to do some sort of imaging of the lungs to make sure that there is no spread to the lungs before you remove the leg. And so typically that's going to be 3-view chest radiographs. Potentially you could do a CT scan as well, but in practice, most of the cases we're doing 3-view chest radiographs or x-rays. The other thing that you would potentially do is have your vet aspirate the draining lymph node. The other thing about amputation is it is not a curative procedure because for osteosarcoma, there's such a high spread rate. And that's usually where I get involved in these cases. After amputation, typically about 10 to 14 days after that incision is nice and healed, we're going to start chemotherapy. And I'll be honest, guys, chemotherapy in some ways is the easiest part of this whole osteosarcoma process, in the sense that getting through the amputation is often the most difficult part for the family to get through. So one of the things that I think is really important is to be prepared that your dog is going to have a really big shave job on the day that, they come home from surgery. So for the front leg, when they're removing at the scapula. And so, your dog's chest is going to be shaved, very big shave job. And a lot of owners don't want to see this very large incision. So usually what I recommend to clients is to bring an old t-shirt, and we'll put that t-shirt on so you don't have to see the incision. We are going to ask you to check the incision daily for redness and discharge and things like that. But sometimes it's nice. A t-shirt can be a good thing. So, ask your vet if you can, or your surgeon if you can bring a t-shirt and cover it up. The other great resource for 3-legged dogs. So 3 legs is often called a tripod. So there's a great site called Tripods, TRIPA WDS, and we'll throw a link below in the video. And this is a great community of three-legged pet owners, dogs and cats. And not all of them have had cancer. Sometimes we'll have dogs that have had trauma, like hit by car, but it is really just a great resource. And, you know, owners can really share their experiences. And so don't take it from me, but talk to pet owners as well. And the other thing is, you're on YouTube, guys, and we're going to include videos here, but you'll see other videos of three-legged dogs still doing all the things that they do. So I've had dogs when I was in upstate New York that are still sheep herding, and dogs that can still swim and still go on walks and still have a great quality of life. There still will be a recovery period, and there still will be an adaptation period for your dogs. But one of the things that continually impresses me about dogs and cats being a veterinarian all these years is how well they recover and their resilience. Like this dog, Jerry, overnight, you know, he's standing with his bandage up, ready to go. I was actually out of town, and my internist, Dr. Keith Sobel, sent a video, and he said, here's Jerry, you're gonna see him in 2 weeks when he starts chemotherapy. But his tail was banging so much in ICU that he was waking up all the other animals, so they moved him over into the doctor's office. But here he is the day after surgery, standing, happy Labrador, and, you know, just really, really doing well. Will your dog be on pain medications? Absolutely. And that's why they're going to spend at least one night in the hospital. I'm not going to minimize that this is a painful procedure. That's why they're going to be in the hospital. We're going to be proactive with pain. We want to prevent pain. We want to get on top of their pain. And, you know, they're going to go home on pain medications as well. One of the other things that I often will have, and you can ask your veterinarian or your surgeon, do they have someone that you can specifically talk to? So I have Bella, who's an owner of mine, and we still are in touch, and she will talk to other owners who are, because she knows the struggle. She didn't want to amputate, so we did stereotactic radiation, and the tumor ended up growing back, and 9 months later, she finally made the decision to amputate Bella. And years later, Bella's mom will still get on the phone, Joanne, and talk to owners and help them through that. And she looks back and said, gosh, Bella did so well. Bella lived 4.5 years later. So I told you that I'm really comfortable recommending it, and that's years of seeing patients do really, really well, and owners coming back to me saying, I'm really happy I did it. My dog's quality of life is really great. Also, there's a really good study that came out in 2015 that looked at 64 dogs that had amputation, and they wanted to know what the owner satisfaction was. And the results of this study are really, really great. So 91% of owners of 64 dogs said there was no change in their dog's attitude after amputation. 88% said their dogs had complete or near complete return to pre-surgery, pre-amputation quality of life. Almost 90%, guys. That's how satisfied these owners were. 78% said the recovery or the adaptation was better than expected. 73% of the pet owners said that there was no change in their recreational activity. So these dogs were still able to swim, go on walks, go on hikes, and do things. Like I said, I've had dogs that still sheep herded, you know, herd sheep herded, whatever. But they were still able to herd sheep. So that was a border collie when I was in upstate New York. So that's really exciting. Dogs that are more overweight, they are not going to do as well potentially with an amputation because, again, there's more weight to redistribute onto those 3 legs. That really makes sense, right? So if you have an overweight dog, they may have more issues than if you have a nice lean dog, which is another good reason why it's important to have a lean dog, because studies show that having leaner dogs live longer. There's a great study that I always talk about of Labradors. So lean Labradors live 2 years longer. Think about that in like people years. It's like, you know, 10, 14 years longer. Okay, last thing that came out of this 2015 study. Would owners do it again? 86% said they would do it again. And the owners say to me, oh my goodness, I'm so happy with my dog's quality of life. But the point of this video is so many dogs are told that they're not amputation candidates, and then they actually are candidates. Another dog that I want to tell you about is another Bella, and she was told, because she was a Great Dane, that she was not a candidate for surgery. You know what? She was. Her tumor, when I met, and we're showing you pictures, was huge, but she actually was a candidate. Just because your dog is a Great Dane or a certain breed does not mean that they are not a candidate. This dog was maxed out on her pain medications, and she was non-weight bearing when she came in. She was not putting weight on her leg. She was already telling me and her family, I'm gonna be okay as a 3-legged dog. So if you've been told your dog isn't, let's get a second opinion. See a cancer specialist, see a surgeon. If you have watched this and now it's time to find a cancer specialist, we'll put a link there. So vetspecialist.com is a great place to find a veterinary cancer specialist. For osteosarcoma, just so you know, you do need chemotherapy to delay the spread, because it's not going to, amputation is to remove the source of pain, but it is a cancer that spreads. There's some cancers that amputation will be curative, like a low-grade cartilage cancer called chondrosarcoma. But, you know, for osteosarcoma, usually the amputation's the first step. And then you see me, and they get chemo, and 80% of dogs have no side effects with chemo, and they do super fantastic. And now there's this cool immunotherapy. So we're gonna have some new osteosarcoma videos coming out in the next couple of weeks if you're watching this when this is first published. But I have tons of videos with osteosarcoma, so check out the bone cancer osteosarcoma playlist. Please like, please comment, and don't forget to subscribe. Thank you so much, guys. Kick cancer's butt. I hope this was helpful, and I'll see you all soon.